Hi guys, so today I am going to talk about the cholinergic agonist. Okay, so this video will provide you all the drugs that are under the cholinergic agonist, which stimulate the parasympathetic nervous system. Okay, we need to understand how the acetylcholine is formed. So acetylcholine, it is firstly formed from the choline and acetylcholine. These two um, molecules they combine with each other via the enzyme called as the choline acetyl transferase and form the acetylcholine. There is acetylcholine. It is um, transformed into the vesicles, and whenever the action potential comes, uh, there is a inward flux of the calcium. So this calcium it causes the acetylcholine to be transformed from the neuron into the synaptic cleft. Okay, so there this acetylcholine it forms the it has its action, physiological action, and it is terminated by the enzyme called as the acetylcholine esterases. So this enzyme converts acetylcholine into the acetate and choline. Okay. Now we should also know how the muscarinic receptor and the nicotinic receptors are distributed along the body and how they work. So muscarinic receptors are there. There are five types of muscarinic receptors: M1, M2, M3, M4, M5. But the thing is that we don't know the M4 and M5 function, so leave it. So M1 location and function of the M1 is they are found in the autonomic ganglia, gastric glands, and enteric neurons. Okay, and they cause the depolarization, late and histamine release, and acid secretion, and increase intestinal secretion, learning, memory, and motor activity. Okay. Now M2 they are mostly located on the heart, and they cause a decrease in velocity, rate of impulse generation, and contractility. Okay, and M3 these are found in the visceral and bronchial smooth muscle. It causes the contraction whenever the M3 receptors are stimulated. They cause the contraction of the visceral and bronchial smooth muscle, iris. It also causes the constriction of pupil and ciliary muscle contraction, exocrine glands, secretion, and vascular endothelium causes vasodilation. Okay. Now nature. So nature, the M1 and M3, they are primarily coupled by the GQ type of protein coupled. Okay, and this M2 they are coupled with the GI or GO or G0. So this transducer mechanism for the M1 and M3 are the same. They increase the cytosolic calcium and causes the uh, prostaglandin synthesis to be increased. Okay, and agonists of the M1 are the oxotramorin, and for the M3 is the bethanacol. And for the antagonist, we have the pyrazine and telenzine for the M1, and for the M3 we have the solinefacin and the darifenacin. Okay. Now coming to the nicotinic receptors, so we have two types of nicotinic receptors. First one they are found in the at the neuromuscular junction, and second they are found in the autonomic ganglia, adrenal medulla, and in the CNS. Okay, and the function of the neuromuscular junction is the contraction of the skeletal muscle. Okay, and the depolarization of the muscle plate, and in case of the uh, nicotine receptor found in the autonomic gland. It causes the depolarization or post-ganglion impulse. Okay, and in the adrenal medulla, it causes the catecholamine release, and in case of CNS, it causes the site-specific excitation or inhibition. Okay, and now coming to the transducer mechanism of the N. So it causes the opening of cation channels, sodium and potassium channels, and in case of NN, it causes the opening of sodium, potassium, and calcium channels. Okay, and agonists are the PTMA and nicotine in case of the neuromuscular junction, and in case of this NN, we have the DMP, that is the dimethylphenyl piperazinium and nicotine, and in case of antagonists, we have the tuberculare and alpha bungarotoxin in case of the neuromuscular junction, and in case of this autonomic ganglia, we have the hexamethonium and the trimethophan. Okay. Now comes the very interesting part and the very simple part of the video. So we have the cholinergic drugs. They are divided into two parts: direct and indirect. Direct acting cholinergics, they directly stimulate the receptors like muscarine and nicotine receptor, and mimic the activity of the acetylcholine in the process. Okay, so for the cholinergic, we should watch for exacerbation of COPD, asthma, and peptic ulcer in susceptible patients. Okay, now direct agonists are the bethanocholine, carbacolone, methacholine, and pilocarpine. Okay, so action, bethanacol, it activates diaphragm, smooth muscle. Okay, and yeah. Bethanacol acts on muscarinic receptor. No nicotinic activity. Okay. So here is a very cute mnemonic to remember this bethanacol. Okay. One sec. So bethanacol me to activate your bladder. Okay. So this is very funny mnemonic. Okay. And application it is in urinary retention. Okay. Then carbacol. Carbachol carbon copy of acetylcholine but raised into acetylcholine stage. Okay, and it is used in the constitution of people and used for the intraoperative meiosis induction. Okay, and in case of methacholine, it simulates muscarinic in the airway when inhaled. Okay, and it is for challenge test for diagnosis of asthma. Okay. Pilocarpine is by far the most important drug among the direct acting cholinergics. So it contracts pupillary muscle in the open angle and pupillary sphincter in the glaucoma, in the close angle glaucoma, and it is a resistant to acetylcholine can cross BBB. It is a blood-brain barrier. You cry, drool, and spit on her below. Okay. So, and it is potent stimulator of sweat, tears, and saliva. Okay. And it is used in the open angle and close angle glaucoma and xerostomia. It is a Sjogren syndrome. Sjogren. How is the name? This slide contains the summary of important points of the direct acting cholinergic agonist. Okay, so so read, read, read it. Okay. Okay. So now we are going to talk about the indirect acting reversible cholinomimetics. Okay. So in this case, we have three types of drugs: carbamates, alcohols, and miscellaneous. Okay. In carbamates, we have the tertiamine, which we call as the pyrostigmine, and quaternary ammonium compounds, which we call as neostigmine, pyridostigmine, distigmine, and ambenomium, and the brimacarium. Okay. So you should know these all drugs, especially the neostigmine. physostigmine, prednisone, and the distimine. You can forget the last two, amphetamine and the demecrim, but you need to know this four drugs. Okay, and in case of alcohols, you should know the hydrophonium. Okay, and miscellaneous. These are all the drugs which are used for the treatment of the Alzheimer's disease. Okay, saccharin, donepezil, galantamine, and the rivastigmine. Okay, now funny mnemonic. Okay, so donepezil, rivastigmine, and the galantamine. Okay, they increase the acetylcholine, and it is a fourth line for treatment for the Alzheimer's disease. Don't ever forget the gala. Okay, this is a cute mnemonic to remember this drugs. Okay, neostigmine. Now, uh, it 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 also increases the acetylcholine in the presynaptic terminal in the scientific lab. But the thing is that this no CNS penetration due to positive charge. Okay, you can okay. So now post operative and neurologic ileus myasthenia gravis and reversal of a neuromuscular junction blockade. Okay, this is important post-operative. Okay, and pyridostigmine does not penetrate. It does not penetrate the CNS, and it gets rid of myasthenia gravis. Okay, yeah. Okay, and myasthenia gravis long acting. Okay, so I will give you a list of the drugs which are used in the myasthenia gravis. Okay, so first of all, edrophonium, it is used to diagnose the myasthenia gravis. Okay, then we use the neostigmine for symptomatic treatment of the myasthenia gravis, and pyridostigmine for the long term treatment of the myasthenia gravis. Okay. This slide shows the summary of all the points that I have discussed in the previous slide. You can read it and understand it. Okay. Now, indirect acting irreversible organophosphates. Okay. So we have only one drug which is therapeutically useful, which is the ecotherapy, and works are the Zarin, Cuban, and Soman. Okay. And insecticides are the parathion, malathion, diisopropyl fluorophosphate, DFP, TMPP, and OMPA. Okay. So, these are the number of synthetic organophosphate compounds have the capacity to bind covalently to the acetylcholinesterase. Okay. So, the result is a long-term increase in the acetylcholine at all sites where it is released. Many of these drugs are extremely toxic and were developed by the military as nerve agents. Okay, and related compounds like parathion are used as insecticides, and this type of this can cause poisoning, which is called as a organophosphate poisoning. So so this slide is very important for us. So anticholinergic poisoning or the organophosphatase poisoning. Okay. So often due to organophosphates as in the parathion that irreversibly inhibit ACHE. That is a acetylcholine esterase. Okay. So organophosphate commonly used as a insecticide poisoning yields in farmers. Okay. So muscarinic effects, diarrhea, urination, meiosis, bronchospasm, bradycardia, emesis, lacrimation, sweating, and salivation. Okay. So you can remember this all the effect by the mnemonic called as dumbbells. Double D for the diarrhea, U for the urination, M for the meiosis, B for the bronchospasm, B for the bradycardia, E for the emesis, L for the lacrimation, S for the sweating, and S for the salivation. Okay, and this effect is reversed by the atropine. Okay, now atropine is a active inhibitor of this acetylcholine. So adrenaline can cause BBV, that is blood-brain barrier, to relieve CNS symptoms. Okay. Now nicotine blockade. So neuromuscular blockade mechanism similar to succinyl CoA. Okay. Now this succinyl CoA is important as it is a depolarizing neuromuscular blocker. Okay. So it is revealed by the pralidoxim. Now what the frick is this? Pralidoxim. So pralidoxim is basically a drug which inhibits these drugs, these organophosphate poisoning drugs. Okay. So yeah, it regenerates acetylcholine state via dephosphorylation if given early. Okay. Must be co-administered with atropine to prevent the transient worsening of symptoms. Okay. Palidoxime does not readily cross BBB. Okay. Now, CNS are respiratory depression, lethargy, seizures, and coma. Okay, guys. So that was it for the today. I tried something different. If you like this video, then please like the video and subscribe. Thank you, guys. Thank you.